Wonderful. Okay, great. So I'm sharing my screen. Let me know if you can't see it, but I think everything should be working. Thank you all again for joining. Today we're going to discuss the records management requirements for the TPA. To kick us off, I want to walk through a few housekeeping items. As I mentioned, we'll provide the slides and a caption recording. We'll provide the slides and the reference guide right away, but the caption recording is going to take a few weeks for us to get back. We are taking attendance of this session today, so we'll send the list of everybody who attended to GDIT by Friday. And make sure to ask any questions you have in the chat as they come up. We have a number of records management experts on the line that would be happy to answer your questions. We're also leaving time at the end for anybody who wants to come off mute and ask their questions live. So we'll look forward to hearing and seeing the questions you all have. Here's our agenda for today. We're going to talk about all things records management. We'll walk through the records lifecycle, talk about records control schedules. We'll have a few knowledge checks throughout and some case studies to make this a little bit more relatable. And we hope that by the end of this training, you'll be able to define what a federal record is. You'll be able to determine which schedule applies to any given record, explain the unique records management requirements for the World Trade Center Health Program, and name your responsibilities for records management as a government contractor. So we want to give you all a clear understanding of what your records management requirements are for the program, and this is also a contractual requirement, so we are satisfying that requirement by offering this training and recording to you all. Okay, we are going to dive right into our training. And if everybody could make sure that their microphone is muted, I think we have a few hot mics. Thank you all so much. Okay, so there are several different types of records you will encounter while working as a contractor for the World Trade Center Health Program. The first is a federal record, and these are materials that are created while working on program business. So these might be applications that you receive from prospective members. These could be project reports or data files. We also have non-records that you might encounter. These are things like extra copies of documents or drafts that aren't shared officially with the program. We have lots of reference materials that would be considered non-records, or any item related to business that's not related to the program. And lastly, we have personal records. So these are things that are materials completely unrelated to program work. These could be your personal notes or unrelated emails. Diving into specifically federal records are any materials regardless of format. So they could be in paper format or electronic digital files. And these are things that are created or received while performing work for the World Trade Center Health Program. Here are a few examples of records that you might encounter while working for the program. And this is not an exhaustive list, but it's a good way to get an idea of what you might come across. So enrollment applications and any supporting documents would be considered federal records. Enrollment decision letters, HIPAA and designated representative forms, the entire certification package, so that WTC3 package would be considered a federal record, and then also member medical records while they're enrolled in the program. And lastly, even things like recordings of member calls to the call center would be considered federal records. So NARA, which is the National Archives and Records Administration, created this really handy decision tree to help you figure out what is a record and what isn't a record. So this can be a helpful tool as you're determining what you're working with and whether it's a federal record or not a record. So let's play a little knowledge check game. I'm going to put some examples up on the screen, and I want you to share in the chat if you think these things are federal records, non-records, or personal records. So first, we have the record-keeping copy of the contract monthly report. Put in the chat if you think this is a federal record, non-record, or personal record. All right, awesome. I'm seeing federal record. Fabulous. Lots of answers coming in. Awesome. You all got it. This is a federal record. This is the record keeping copy, so that would be a federal record. Next, we have photos your colleague sent of their dog. I'm sure they're very cute. Would this be considered a federal record, a non-record, or a personal record? Awesome. I'm seeing lots of personal records. Fabulous. Great work. Next, we have claims records. Are these federal records, non-records, or personal records? You all are pros. Federal record. Awesome. All right, and one more for you all. We have the calendar invitations I sent to your email to the records management training. Would you consider this to be a federal record, a non-record, or a personal record? Too many things coming through. I can't keep up. I would say this is a non-record. This is related to your work, but it's not the record-keeping copy. I have the record-keeping copy as the creator. Awesome. I see lots of that, those responses. So great work, everybody. Thanks for playing. Seems like you're all experts in determining what's a record and what's not a record. Next, we're going to talk about the record's life cycle. So all records operate through a life cycle that begins when the record is created. Then the record needs to be maintained and managed. And then once the business and legal use of that record ceased, it's time to disposition that record. So that was a lot of jargon. We're going to walk through what all that means in the next couple slides. So as I mentioned, as you generate records and perform work for CDC, you're creating records. That's the first step of the life cycle. Then we go to the phase of maintenance. So these records have to be stored. They need to be stored in a secure manner and in an organized way so we can access them as they are being used. And then comes the time for dispositioning. So either at the end of the contract or at the end of the record's retention period, we have to decide what we're going to do with that record. Is it going to be retained permanently or is it going to be destroyed? And this decision is, you are instructed by CDC about what to do with those records based on a records control schedule. So again, something we'll talk about in a moment, but basically, two options for disposition are either they're retained permanently as permanent records or they're destroyed because they're they're temporary records. So looking a little closer at creation, again, the life cycle of a federal record begins when it's created, and records can be created in many different formats. They might be paper documents, digital files, they could be emails, spreadsheets, or forms. They could also be audio recordings. So we had mentioned call center recordings might be federal records, and that's where audio recordings would come in. After a record's created, we have to begin managing that record. And it's important that we store the record securely and in an organized fashion. Paper records can be stored in offices, federal record centers, or in offsite storage. We also have electronic records that we need to store using digital systems. We could store them in shared drives, SharePoint, or in a database or system. And it's important to note that we have a lot of collaborative environments that we use these days, like Microsoft Teams, but federal records should never be saved in that environment. Make sure to save documents and records according to your organization's policies and in their approved repository. Next, we have the disposition. So once a record is no longer needed for business use and the appropriate retention period has been met, it will be dispositioned. So this is basically when records, we don't need them anymore for current agency business and they've been kept for the appropriate amount of time. We have to decide what to do with them. This is a really important part of the records lifecycle, and it makes sure that we handle the records appropriately and in a alignment with federal requirements when they're no longer needed. And we determine what to do with these records based on the record schedule. We're going to dive deeper into that in the next section, but we have to decide whether the record is considered permanent or temporary. Permanent records are things that have enduring value to the United States and need to be preserved forever in the National Archives. Temporary records, on the other hand, are things that don't warrant preservation and they need to be destroyed as determined in the record schedule. Okay, so I have another knowledge check for you all. Which statement about disposition is true? Again, feel free to add in the chat. All federal records are eventually transferred to the National Archives. B, contractors can destroy temporary records once the retention period is met. C, permanent records have enduring value and warrant preservation in the National Archives. Or D, disposition only applies to paper records, not electronic records. Go ahead and add in the chat. Seeing a lot of C's come through. Amazing. We have some records management experts. Perfect. The correct answer is C. Great job, everybody. And then I noticed a few folks have mics on. If you wouldn't mind muting, that would be wonderful. Thank you so much. Okay, so now we're going to get into the section about records control schedules. So first, what is a records control schedule? These records control schedules tell us what to do with federal records throughout their life cycle, from creation to final disposition. And these are legally approved documents that specify how long we have to keep a record, so that's its retention period that we talked about, and what happens to it after it's met its retention length. So that's the disposition, whether it's a temporary record and needs to be destroyed, or if it's a permanent record and is retained in the National Archives. So the TPA is really unique, and we have several different records control schedules that may apply to the work that you all do. So those might include the General Records Schedule, the CDC NIOSH agency-specific record schedule, and also the World Trade Center Health Program records control schedule. I do want to note that the last records control schedule, our program's records control schedule, is undergoing approval and review. So we'll get into that on the next slide, but this is something to keep in mind. So the World Trade Center Health Program records control schedule applies to records that document a function, decision, or activity that is unique to the program itself. So these might include things like our enrollment records, our certification records, appeals records, and member clinical or case history. And this is not an exhaustive list, but again, some ideas to help you understand what we're looking at. And this records control schedule is with NARA right now. It's undergoing review and approval. And so until further notice, because it's not approved, all records that fall within this scope have to be treated as unscheduled or permanent. We also have the CDC and NIOSH agency-specific records control schedule. So if a record doesn't fall under that World Trade Center Health Program records control schedule, but it documents something that is specific to CDC or NIOSH programs as a whole, then we would need to use the agency-specific RCS. We also have a separate record schedule that I mentioned, the general record schedule, that is much more broad. And this agency-specific schedule takes precedence over that general record schedule when they cover the same type of record. So the general record schedule is something that's established by the National Archives and Records Administration. They created these schedules because a lot of agencies have the same types of documents, and they didn't want to duplicate efforts creating separate record schedules. So they came up with these common disposition authorities for federal records that we see across many different agencies. And these apply to federal records that document administrative, financial, and operational activities. So how do we determine which records control schedule applies when? It's really important to note that these schedules apply concurrently. So we have to look at them together and determine what the appropriate retention and disposition is for a record. So if a record falls under more than one schedule, the TPA contractor has to evaluate the function of the record and pick the right schedule according to what the record's function is. Okay, so another knowledge check for you all. Your team is processing certification applications for the program, and you know that the World Trade Center Health Program records control schedule is still undergoing that approval and review process. So how should you handle these records? Do you use the GRS retention period since there's no approved schedule? Do you treat them as treat them as temporary records and hold them for 7 years? Do you treat them as unscheduled or permanent records? Or do you wait until the schedule is approved before processing them? Awesome. I'm seeing lots of C's. Fantastic. These should be treated as unscheduled and permanent records. Okay. So records management requirements. The TPA has a lot of different service areas that produce different documents. You're also going to be receiving a lot of different document types, and we need to make sure that all the records that are generated or that you all touch are managed in accordance with federal records management requirements. But the expected handling, retention periods, and processing requirements do vary based on the different documents. So it's a little bit complicated. So in the next sections, we're going to kind of talk through some specific examples and do some case studies. So we have a lot of applicant and member records that come in, and let's say we get a certification package, for example. Maybe actually an enrollment package would be better. So we get an enrollment package in that's got the application, and it also has some supporting documentation and a HIPAA form. That's a mix of temporary and permanent documents. So it's really important that we are aware of these different document types, the nature of those documents, the function of them, and we got to pull them out so that because they're retained differently depending on the type of document. It's important to note that the official record keeping copy has to be maintained in a complete legible format that's suitable for long-term retention. For documents that are tentatively scheduled to be permanent, there are special digitizing requirements. We recommend a minimum resolution of 400 pixels per inch and a destination file format of PDFA. This is pretty in the weeds, but it's important to know for making sure that the documents are aligned with the NARA recommendations. Also, the digital records that are a result of any scanning, they should be complete, legible, and suitable for long-term retention. We also want the TPA to maintain an applicant and member records repository that's centralized with a person-based file structure and organized. The files have to be organized by individual and include relevant identifying information. This makes sure that we're able to retrieve records as needed and that they can be provided to the program as requested. This is an example of the person-based file structure. We defer to the TPA on the best structure for their repository. We did want to highlight the Mail Center. The Mail Center receives a ton of different records, and we want to set clear expectations for how we want the Mail Center to handle these records. We need to make sure that we have an accurate and complete digital surrogate of any mail received in electronic format. We also want the paper record, or we say that the paper records that might be retained temporarily should be organized by document type and date, and they should use standard calendar dates to organize these documents. If the TPA needs to batch documents for intake, they must be separated by document type and person during processing. And documents should not be stored in unidentified undefined record categories like other and miscellaneous. Also, if the TPA is stamping documents upon intake, they should make sure that the stamps do not obscure any record data. So in this next section, we're going to dive into specifics of our expectations. We're going to walk through some of the different specific documents you might come across and how the handling and retention might vary for those document types. So first we have our call center recordings. So recordings of call center phone conversations should be treated as temporary records. These are governed by the general record schedule and are dispositioned. Their disposition is temporary. So these call recordings should be maintained in a secure environment and then destroyed after 1 year once they're resolved or when no longer needed. Enrollment records, so these are records which are created as part of the enrollment process. These should be treated as permanent records. So this might include things like applications, supporting documents, welcome and denial letters that are part of the decision pathway. And these are governed by the World Trade Center Health Program records control schedule. The current disposition on these is unscheduled. That's because our records control schedule is not yet approved. And we have proposed that the disposition for these records is permanent. These have enduring value to the United States, so they warrant preservation in the National Archives. But again, that's a proposed disposition. We haven't gotten that schedule approved yet. So because these are proposed to be permanent records, we suggest that you digitize them at 400 pixels per square inch and use a destination file format of PDFA. These records need to be stored in that person-based repository. And the records should be delivered to the program as requested. Appeals are similar. So appeals are records that are created as part of the appeals process, and they are permanent records. This might include things like appeal submissions, supporting documentation, appeal decision adjudication letters. Again, this is governed by the program's RCS. So these records are currently unscheduled. Same digitization requirements and destination file format suggestions. And we want these records to be able to be delivered to the program upon request.
Haley, I have a question.
Yes, please.
So these records that you just went through, like they could be paper that then is converted to the digitized record. So are you saying that both the paper and the digitized record are both requested to be permanent, or is one versus the other acceptable?
Yeah, and Kelly, feel free to jump in. But once we have that record keeping copy digitized, once we have the digital file, that's considered the record keeping copy. Kelly, do you want to specify any more?
Yes, that is correct. So, you'll be receiving a number of files, some in paper format, some in digital format. We're asking that there is some sort of workflow in place. For example, say a member scans in documents, they might not be at the correct resolution type that NARA needs for preservation purposes in the archives. So we're asking that you have some sort of workflow check that ensures they're at the right resolution and that they're saved, stored in the PDFA archive type. And then for paper records that are digitized according to spec, you might want to hold on to the paper temporarily for business use. For example, maybe we'll have a quarterly transfer cycle that we agree upon. In that sense, we will give you authorization to go ahead and remove and destroy the paper records that are considered copies in that sense, transitory records that can be destroyed once we have confirmed that the record keeping copy exists and is in appropriate format for transfer to NARA.
Thank you.
Thanks for the great question. Okay, so certification records are similar. Records that are created as part of the certification process should be treated as permanent records. And this might include things like that WTC3 package, any supporting documents, and decision letters documenting certification documentation. This is governed by the World Trade Center Health Program, RCS. So they're currently unscheduled records. We suggest you digitize to those same requirements and have that destination file format of PDFA. Claims processing records. So these claim records that function solely as financial transaction records are governed by the General Record Schedule. So this might include things like payment processing logs, reconciliation spreadsheets, contractor payment system, audit trails, and explanation of benefit-like documents. So this is governed by the General Record Schedule, and the disposition on these is temporary. It's really important to go to the General Record Schedule and look at the relevant schedule to determine the appropriate retention period depending on the type of document, and these may be destroyed once the authorized retention period has been met. I did want to note that sometimes claims records are used as supporting documentation in either applications for enrollment in the program or as part of the certification package. And in that case, claims records would be considered permanent documents because they're used as supporting evidence as part of that enrollment or certification process. So it's not, generally speaking, there are instances in which claims documents would be considered permanent documents. Next, we have communication records. So these are communication materials that disseminate information about the program externally to our applicants and members. And these should be treated as permanent records when the TPA is the primary owner of the record-keeping copy. These might include things like outreach materials, newsletters, fact sheets, postcards, flyers about the program. And again, this is when the TPA is the primary owner of these documents. This is governed by the World Trade Center Health Program Records Control Schedule, and these should be treated as unscheduled at the moment. We propose that they be permanent records. So again, should be digitized if they're paper documents, use that destination file format of PDFA. And these should be delivered to the program upon request. For correspondence records, these are communications that document correspondence to or from the World Trade Center Health Program and our members or other program contractors. And these are tentatively scheduled to be temporary records. So these might include things like formal correspondence or structured informal correspondence, such as claims question forms. These would be governed by the World Trade Center Health Program Records Control Schedule. They are unscheduled records right now, but we propose that they are temporary records. So there's no specialized storage requirements for these, just need to make sure that they are complete and legible. And we cannot destroy these records until they have an approved disposition authority in place. Next, we have our HIPAA and designated representative records. I briefly mentioned this in the last section. These records are temporary records under federal law. So these would include things like the HIPAA disclosure form, the designated representative form, and then the HIPAA designated representative form. These are governed by the HIPAA privacy rule, and they are temporary records. So these need to be separated from other permanent record types like enrollment packages at intake. That's because they need to be retained for 6 years from the date of creation or when they were last in effect, whichever one is later. So these documents have specific handling requirements separate and we don't need to maintain these in the National Archives. They're not permanent records. Next, we have member medical records. So these are things that document a member's medical and health history while enrolled in the program. These are tentatively scheduled to be temporary records. So these might include clinical records, prior authorizations, case management records. And again, this is when the TPA is responsible for the record-keeping copy of these documents. And again, I want to mention that sometimes prior authorizations and other records like this might be considered permanent when they are attached to that enrollment or certification package. So something to keep in mind. These are governed by the World Trade Center Health Program Records Control Schedule, and we have them They are currently unscheduled, but we have proposed that they be temporary records. So we need to make sure that these records are complete and legible in the digital format. They can be stored separately from that person-based repository. We defer to the TPA on the best way to manage that, but these records cannot be destroyed until an approved disposition authority is in place. Okay, I know that was, again, very in the weeds. Does anybody have any questions right now on this before we move on to our case study? Okay, great. And feel free to ask questions in the chat or bring them up at the end too. So we will make this a little bit more understandable by diving into a case study. So we've got our friend Mary Smith. She is applying to the World Trade Center Health Program, and via mail, she sends her application for enrollment form, her HIPAA form, and her designated representative form. So we're going to trace each document as it makes its way through processing to see how different records management requirements apply. So for these documents, she mails them in, they get to the mail center, and they are processed. So the envelope contains 3 different documents that we talked about. If the mail center is stamping these documents with a date, these stamps should not obscure record data. And let's say a staff member scans Mary's paper documents in. We need a complete and accurate digital surrogate of all these documents in an electronic format. For permanent records, again, we have the specialized scanning requirements. They need to be scanned at 400 pixels per inch with a destination file format of PDFA. And in this example, that permanent record would be considered the application form and any supporting documents for that application package. We don't have any specific scanning requirements for temporary records. They just need to be legible and complete. So that would be the HIPAA form and the designated representative form. So for digital processing, again, these records need to be legible, suitable for long-term retention, and the digital version is considered the record-keeping copy. So once we have those paper documents scanned in, the digital version is the record-keeping copy. That's the federal record. And documents need to be separated by type and person. So in this example, separating by type means that we need to pull out those HIPAA and designated representative forms because they are temporary records. So that retention period for those is 6 years. They can be scanned at any resolution. They have to be legible, and they can be saved in any file type. The application and supporting documents, on the other hand, are considered a permanent record. So we need to store these records in that person-based repository. This repository should be distinct from the document that's maintained in the member's care profile. And the documents or the files must be retained in a manner suitable for transfer to the program for eventual disposition in NARA. So again, these are permanent records that will be maintained and preserved forever in the National Archives. So we have to meet NARA's standards on those. So separating by person. The TPA is responsible for maintaining applicant and member records in a centralized repository with that file-based structure. So again, this is an example of Mary's enrollment records stored in the person-based repository with some other members. These files have to be organized by individual and include relevant identifying information. But this is just an example. We defer to the contractor on the best way to set up that repository. So now that we have digitized all of Mary's records that she sent in, the paper copy of the records may be destroyed once the digital copy is available if the destruction is authorized by a NARA-approved records control schedule and the paper is no longer needed for business use. If you are temporarily retaining the paper records during processing, make sure to organize them by document type. using standard calendar dates, and the document types have to be defined. We can't use other or miscellaneous. These are not acceptable document categories. So let's fast forward a little bit and think about Mary's certification. So Mary is accepted as a member into the program, and 6 months later, the TPA receives Mary's WTC3 certification package. So she sends that in, or it is sent in for her. And so the TPA receives that certification application, her medical records related to her certification, and her supporting documentation. So question for you all, are these records permanent or temporary? Feel free to add in the chat, permanent or temporary. Awesome, lots of permanents coming in. Fabulous. That is correct. These are all treated as permanent records because they are associated with Mary's certification, and this has enduring value to the United States. We propose that these be retained permanently. Okay, so let's do another knowledge check. 6 months after Mary has enrolled, she calls the call center with a question about transferring clinics. The call is recorded. So what should happen to this call recording? Do we A, add it to Mary's permanent member file, B, retain it for 1 year after her question is resolved, then destroy per the general records schedule? Do we send it to NARA immediately, or do we D, keep it for 6 years per HIPAA requirements? Fabulous. Yes, this is correct. The correct answer is B, retain for 1 year per the general records schedule. Okay, so some key takeaways from this case study. It's really important to note that documents that arrive together may have different processing and retention requirements. So in this example, we had her enrollment application, and that was a permanent record, whereas her HIPAA and designated representative forms are treated differently. So it's important to recognize those differences and pull out those documents that might have different requirements. Also, person-based filing helps us keep records consolidated and makes it easy for that transfer of documents back to the program when requested. Makes it easy to adhere to those records management requirements and helps us find the complete history when needed. And separating documents at intake ensures proper handling across record types. Okay, we are going to discuss contractor responsibilities. So records management is something that's required by federal regulations. And as a government contractor, you have to make sure that you are meeting these regulations. So any records you create in your role for the program are likely considered federal records. So you're required to create and maintain records as specified in your contract. You have to ensure that all the records you create for the government are accurate, complete, and organized. You have to acknowledge that the government is the owner of these records and you need to deliver them as requested. And make sure that you are providing all relevant documents, any supporting and background data as required by your contract and upon request. Also, do not remove or destroy CDC records without that written authorization. Additionally, you must retain and dispose of records properly. So make sure to retain CDC-related records for the necessary amount of time as specified in your contract or as directed by the program. At the end of the retention period or the contract, you need to transfer or dispose of the records as instructed by us. And then it's really important that you protect and secure these records. We are a covered entity, so we need to make sure that we are safeguarding these records against loss, unauthorized access, or destruction. We have to maintain the records so that they can be readily found when needed. It's important to separate temporary and permanent records and keep the personal files separate. And I don't think that this would apply, but if you're handling classified materials, make sure you have the appropriate authority. I think the same can apply to HIPAA, need to know basis, making sure that we are aware that we're managing people's personal health information and ensuring that you're only accessing the information as needed for your role. Also, as a CDC contractor, you are required to comply with any laws and regulations. So make sure you're managing the records in accordance with federal law and the acts listed below. Also, be prepared to provide records for any audits, FOIA requests, or litigation. And if you're notified by CDC of litigation or records hold, immediately suspend any planned destruction of records and retain them until further notice. Okay, that was a little dry, but here's a college knowledge check for you all. As a CDC contractor, which of these is not your responsibility? A, create and maintain records. B, deliver records to CDC as requested. C, protect records against unauthorized access. Or D, determine your own retention periods for records. Awesome. Which of these is not your responsibility? You will not be determining your own retention periods for records. Great job, everybody. We are heading into our last section. So this section is lessons learned and key takeaways. So we have learned a lot of lessons with document and records management over the years. And one of the things we've learned is that there's a lot of unnecessary paper generation and retention. The Mail Center generates 1.5 boxes of paper documents every week, and we want to reduce this to 0. Things have been retained, like returned mail, and we've also noticed that things have been digitized. So 43 boxes of member surveys were digitized, but then the paper copies were retained and then needed to be reprocessed later. So there's a lot of generation and then retention, and those documents need to be stored. And that becomes really expensive. Documents should also be processed in real time. So previously, the program had to pay to store, ship, and then reprocess and shred documents that should have been processed in real time. The contractor might choose to retain documents in the paper format for quality assurance purposes, but these documents should never need to be reprocessed by the program. Also, we've had some batch processing issues in the past. Multiple record types have been batched and then had to be processed again. So this kind of relates to that enrollment example that we had where permanent documents were mixed in with temporary documents and then weren't processed to the necessary standards, so things had to be done again. Also, records have been stored in undefined categories like other and miscellaneous, and then again had to be processed a second time by the program. We've also learned by reprocessing a lot of these documents that physical processing is really time consuming. So best practice is to avoid staples and make sure to separate any temporary records like those DR forms and HIPAA forms from permanent records. Okay, a few key takeaways from the training today. Federal records include any material created or received as part of CDC business, and CDC owns these records. You must create, maintain, protect, and organize all CDC-related records as specified in your contract and in accordance with federal regulations. Do not destroy or remove federal records without CDC authorization. And if you have any questions about your responsibilities with records management, don't hesitate to reach out to your contracting officer representative. We also have our fabulous records management experts here at the program who will be happy to answer any questions as well. And then as a final reminder, records that are tentatively scheduled to be temporary under our World Trade Health Program records control schedule have an unscheduled status right now and have to be treated as permanent records. And unscheduled records can't be destroyed under any circumstances and must be retained in a manner that's suitable for transfer to the World Trade Center Health Program for eventual disposition to NARA. So just keep in mind our records control schedule for the program is not yet approved. Once we have that approval, we'll make sure to let you all know right away to begin implementing that records control schedule. All right, we have made it to the end. Thank you all for bearing with me. I would love to open it up to any questions or comments people have. Really appreciated your participation today.
Hey, Haley, it's Frank again. When we get a paper document through the mailroom, right, and we digitize it, that digitized copy, as you said, is now the record, and the paper is now deemed to be a copy. I thought I heard you all say that the paper can be destroyed once it's been determined that the digitization was completed and successful. How is that overseen and proven? Do you know what I mean?
Yes,
Like,
I
what are
can
you
jump in
looking
there.
for from us, from the TPA, to show the record has been digitized?
Yeah, Frank, thank you so much. We were just discussing that we really need to identify those quality managed standards as part of our transition in work. Part of the reason we haven't identified them already is because the TPA contractor might have capabilities and technology that we don't currently have on site. So for example, there might be ability for your system to do source data verification and remove the need for manual auditing of a sample record that we do. So part of what we're going to do is look at that and come up with a agreed upon plan for how we can do that. And once we're set up, it is possible that we'll provide some guidance that those records can be destroyed in real time moving forward, or perhaps retained in some cadence. Maybe an annual audit spot check of records, and then that guidance comes out. So that's still something that we're thinking about, but hope to have an answer for you during this time of transition in.
Okay, thank you.
And hey everyone, this is Marie. I have one question about the other category in terms of the mail room, right? So obviously we will do our best to classify and identify as much as we can. Do you have any guidance? And I'm sure this will probably come out in more of those records management work groups, but does the program have formal guidance around if we do get something that really is miscellaneous, how we should be storing it and classifying it?
Yeah, absolutely. Best practice is to always have a file plan. So as you encounter unique document types, putting them in and understanding what the proposed retention cycle and disposition authority that applies would be. If something is other or miscellaneous or you're not sure, we're here to provide support. So we can help say, hey, this is where I would consider it to fall under the records control schedule. This is how I would interpret the record schedule in this case. So we're here, happy to answer any questions and help support you all along the way.
Okay, perfect. So more of like the type versus the actual, hey, we got some public document that doesn't really fit into that document type. So that makes sense.
Yeah, NARA uses something called the big bucket category. And because they don't want to be overly prescriptive or get so granular down to the document type, they group things under these large umbrellas like correspondence or communications. And so we have some broad understanding in terms of taxonomy as to where those might be bucketed under.
Mhm.
But a lot of it leaves it very flexible so that programs, contractors working alongside programs can process these records without undue burden. So our goal is always to make sure that you all can operate effectively and optimize your workflows the way you need to. And like I said, we're mostly interested in compliance with a special focus on that permanent record preservation. Haley really is calling out those because at the end of the day, the risk for temporary records is often that they're just simply maintained for too long, longer than business use is required, or sometimes transferred to the program and causing some reprocessing that has occurred in the past. So the risk in that terms is low, but we really want to focus our energies on that permanent records preservation, because as a federal program, we're unique in the sense that we have more permanent records than a typical federal health plan would, just due to the nature of the events on 9/11 and the aftermath, and the fact that this warrants preservation in our historical archives as a moment of national interest.
Right, makes total sense. Thank you so much. And I have actually seen the box room in Cincinnati, so I understand the plight a little bit.
Awesome. Wonderful questions. Thank you all so much. I did want to note, as we're seeing if any other questions come in, we put a survey in the chat, so please let us know what you thought about this training and how we can improve for next time, or just how we can improve records management in general. We are, this guidance is new, so any feedback you all have, we'd welcome it.
Hey guys, it's Frank again. I have one more question. One of the other requirements we have for the TPA contract is to provide a backup of all data on an annual basis to the program. Obviously, that backup will contain all of these federal records. Does that play into who now holds the official copy of the record? Or how does that work in determining the ownership of the record, if that makes sense?
It does make sense. And Frank, that's a really good question. That requirement more relates to security versus records management. So I think our next steps would be to talk to Tom James with our information technology, security, and privacy team and get a response to you.
Okay.
Awesome. Any other questions? All right, fabulous. Well, thank you all so much for attending. Feel free to reach out if you do have any further questions, and we'll be sure to send the attendance list, the slides, and the caption recording to you all, so you have that for reference. Thanks again. Really appreciate all the great questions.
Thank you. Thank you for your